All right, are we ready to start? I'm gonna mute people. Do you want your questions at the end or you want interruptions? What's best for you?
What has worked best in the
Questions
past?
at the end.
At the end? Okay, we
Yeah,
can
it
do
gives
at
you
the
better
end.
flow. Unless
Sure.
you want to pause at certain points, say any questions, but I that's up to you.
I'm fine with either. If it's been historically at the end, then let's just keep it that way. But if there's a burning question that has to be asked, I'm fine with the interruption as well. So
All right, awesome. All right, so then I'll do an introduction. Dr. Gerber, did you want to introduce Dr. Nana or? Okay, awesome. So for those of you who remember, we had Dr. Gerber and a number of her students that have presented on different subjects relating to pharmacy or medicine, and all of them were quite informative. So when Dr. Gerber said, hey, I have a doctor that has specifically catered or done a presentation that's for geriatrics, all about heartburn and heart attack as well, I'm like, okay, we need to do this. And I knew that there are some Dr. Gerber junkies, like people who just will come on because it's your group, like Judy said. So I am going to allow you to introduce your former, I guess, is a resident, a student, I guess?
No. Nope.
No? Okay, so, no, I meant, was she your student or?
Oh, no, she was not I wish.
She was just your resident, right. So that's what I said. I don't want to do the wrong title on that. So I'm going to let you introduce Dr. Nana Entsuah, and we are very appreciative and look forward to this.
Well, thank you so much for letting us be here today. I know that my students that I had, for those of you who joined us in the wintertime, they actually texted me recently and said that they missed seeing you guys and that they loved giving those presentations. So the appreciation goes both ways. I have been very fortunate to have Dr. Nana Entsuah as my geriatric PGY2 pharmacy resident this year. She actually had graduated from The Ohio State with her Doctor of Pharmacy degree. She then went and did a PGY1 pharmacy practice residency, and she is now closing the end of her year with me. I'm very sad to lose her. She's closing the end of her PGY2 residency year, where she has been specializing in geriatrics or the pharmaceutical care of people over the age of 65. I hope you will enjoy her. She is a very engaging speaker. And with that, I will turn it over to Dr. Entsuah.
Okay. Well, thank you so much, Dr. Gerber, and thank you to you all for being present today. I know that we've been trying to find a good time to give this presentation, and fun fact, it's actually my last presentation of my residency year, and I couldn't think of a better way to spend it than with you all this afternoon. So thank you for honoring the invitation, being here. I'm just going to start off by sharing my screen so that we can follow the slide. So give me one quick moment whilst I pull that up, and I might need your help here, Avi, to get it pulled up correctly. He's been helping me troubleshoot.
I'm on standby.
Okay. All right. So, screen 2. How are we doing? Are you able to see anything yet? Nothing?
Yeah, hold on. It's coming up. There we go. Perfect.
We're good? Awesome. Okay. So as you can see, the topic that we're going to be discussing today is heartburn. And at the end, we'll kind of switch on over and talk a little bit more about heart attack. Now, I know that we have some really specialized, special guest, if you will, the person of Jerry, who's a cardiologist and probably knows a lot about this particular topic and heart attack too. But then we have people like my father who didn't know much about heartburn and heart attack. So just to give you all a little bit of background as to why I chose this topic, I had a conversation with my dad. My dad is going to be 74 in October, so he's still a young man, he likes to say. And he was asking me a lot of questions about heartburn and heart attack, and I thought, well, you know, if my dad needs some clarification or had some questions about this, then perhaps I can put together this presentation, because a lot of people experience it, even myself, that as we get older, of course, we are a little bit prone to having things like heartburn. So I thought, well, my dad just inspired me to put together this presentation. So that's why we're here today, and we'll be discussing it, and I do hope you find it helpful. As Dr. Gerber said, my name is Dr. Nana Entsuah, and I am her geriatric resident this year with Midwestern's program. All right, so let's see if I can move to the next slide here. Let me know what you guys see in terms of the slides. Are you seeing my slides move forward?
Not yet, but try with your keyboard.
My keyboard, okay.
Right or left?
Yeah, it doesn't seem to be moving.
Oh,
If
you know what?
Hover at the bottom left hand, and there'll be little shadow arrows.
But it could be it's only doing slide 1.
Interesting.
All right, go here. Hit escape, which should take you out of the.
Okay.
And now go back to that setup slideshow. I just want to make sure all of it is selected.
Okay. All.
Do you see on the top it says presented by a speaker full screen? Do
Yes.
that.
Okay.
Click on that. Make sure click
I think
manually.
that looks good.
Oh, for advanced slides, hit manually. Middle to the right.
Manually. Okay.
Now let's try it.
All right.
And you can do from beginning.
Okay. Well, thank you all so much for your patience as there we go.
Yep.
You see it move forward?
Perfect.
Awesome. Okay, so some goals for today's presentation, as I mentioned, we'll be talking about heartburn. We'll start off by talking about some of the signs and symptoms of heartburn, and then we'll go into one of my favorite parts as a pharmacist is the medications. So we'll talk about some of the over-the-counter or OTC medication options that are available to be used in terms of controlling our heartburn symptoms. We'll talk about how they work, things to look out for when you take them, and so on and so forth. And then lastly, we'll branch in and talk about some similarities and differences between a heart attack and a heartburn and what to do for a heart attack in place of a heartburn. So those are the things that you can look forward to for the rest of today's presentation. So starting off, a little heartburn 101, if you will, an overview as to heartburn. So what is it? Heartburn is caused or is a symptom of and backflow of stomach acid. Essentially, it's a painful sensation that is typically located in the mid-chest area. A lot of patients will describe it as a very uncomfortable burning sensation that kind of stays here behind the breastbone or even behind the rib cage. Again, it's caused by a backflow of stomach acid or stomach content that can occur flowing back into the esophagus, which is the tube that takes food and liquid into our stomach. So for a plethora of reasons, instead of the food flowing downward, sometimes it can flow back up and irritate the lining of your esophagus, causing or leading to that burning and uncomfortable sensation, which we know to be heartburn. Heartburn may also be referred to as indigestion. So you may hear it described one way or the other, but for the purpose of this presentation, I will be referring to it as heartburn. In terms of its frequency, it can vary. Some people might have heartburn all the time, which is really unfortunate, as you can imagine, having that symptom constantly. And then there are some people who have it on occasion. So it comes and goes, and it differs from person to person. The way that we think about the frequency of heartburn also correlates with its severity. So if someone is having heartburn only on certain occasions, we might consider it as mild heartburn. But somewhere in the middle, we might think of it as moderate. And then if it's more constant or all the time, really, really uncomfortable and painful, we might consider that as severe heartburn. All right, I wanted to spend some time looking over again some of the things that I shared with my dad when we were having that conversation about heartburn. My dad is a spicy food fanatic. He absolutely loves anything spicy. My dad will try it. And so we talked about some of the triggers for heartburn, which much to his chagrin, he realized that a lot of the food items that I listed here were things that are considered his favorites. So that might be your story as well, but I thought we might walk through them and see if that's the case. So in terms of food triggers, again, spicy food, things like caffeine, chocolate, citrus foods like that lemon that we have in that picture here, and even tomatoes. So tomatoes are the sneaky ones in there. They have a lot of acidic content that a lot of people are not aware of. So eating a lot of tomatoes can trigger or contribute to symptoms and signs of heartburn. Other factors that can trigger heartburn symptoms include lifestyle, like alcohol use, tobacco use, rigorous exercise, and even stress. We know that stress affects our bodies and our mentation in different ways. For some people, stress is something that triggers heartburn within them. Lastly, and perhaps most commonly, is body positioning. So a lot of people may realize that if they lay down flat right after they eat a meal, they may have that uncomfortable sensation because, again, we don't have the benefit of gravity kind of pushing that food downwards through our esophagus or that food tube. But rather, when you lay flat, the food kind of sits flat as well, and the acidic content can irritate, the esophagus and lead to heartburn. And then there are also some medications which can increase the likelihood of someone experiencing heartburn, things like Antacids or some aspirin, things of that sort that we commonly use can also irritate your esophagus and cause heartburn. Moving right along, I've talked about some of the things that worsen heartburn. So now I want to talk about some things that we can do in terms of our lifestyle to improve heartburn. The first thing that I shared with my dad was, Dad, you got to cut down on the spicy food. You got to cut down on the caffeine. He didn't like that very much, but that's the first thing that I shared with him, and it's the first thing that I share with you too. Limiting foods and beverages that trigger heartburn. So if you realize that if you eat a lot of citrusy foods or you like a lot of lemon in your tea, the acidic content can trigger the heartburn symptoms. So maybe cutting down on those food items will be beneficial in terms of decreasing the likelihood of having heartburn. Also, avoiding those body positioning changes like laying down flat, even bending over or doing rigorous exercises immediately after you eat a large meal, because again, that prevents gravity from having to do course and processing the food into our stomach, but rather will lead to backflow and cause further irritation that way. For certain patients, it is not possible to remain upright completely or stand or sit up straight right after having a meal. And if that's the case, we recommend that if you have to sit or lay down a little bit, try to raise the head of the bed. If you're laying down, try to raise the head of the bed about 6 inches. So you can prop up some pillows just to give yourself a little bit of a tilt to allow some sort of gravitational work to decrease the likelihood of having more heartburn. Also, things like avoiding tight-fitting clothes, quitting tobacco use, so smoking, decreasing the use of alcohol, weight management, and lastly, stress management are all lifestyle modifications that can be used to benefit in terms of heartburn symptom management. And now we move on to the medications. There are 3 over-the-counter or OTC medication options that are available. I've listed those 3 buckets here. We have the first one being Antacids, the second one being our histamine or H2 blockers, and the third one that we'll discuss being proton pump inhibitors, or commonly known as Ppis. So we'll zoom into each of these boxes to go into a little bit more detail. All right, I thought I'd start off by showing some pictures of antacids. Some of these may look familiar to you. Maybe you've seen some when you're in the grocery store. You might even have some in your medicine cabinet. So these are some pictures of some commonly used antacids that I wanted to start off by showing you. And now I want to talk about them into a little bit more detail. So the interesting thing about antacids is that, as the name suggests, they antagonize acid. So antacids, that's how we get their name. They kind of work to neutralize the stomach acid content so that even if it flows back up, it's not as high in acidic content and won't cause as much irritation. So that's how antacids work. There are many different types of antacids. We have our calcium-based products like Tums or Alka-Seltzer. our magnesium-based products like milk of magnesia, our aluminum-based products like Alternagel and Amphagel, and then our combination products that have a little bit of each of the three that I just discussed. So things like Maalox or Mylanta or Rolate or even Gaviscon. Going back to our calcium-based products, I wanted to share something really quickly here is Alka-Seltzer. And I apologize, it looks like my graphic didn't show, but I had a red circle that was surrounding Alka-Seltzer here. I wanted to highlight that with you all because although Alka-Seltzer is a calcium-based antacid, it also has a high content of aspirin. So for our patients that are taking blood thinners or patients that have that are prone to having bleeding disorders, we recommend against the use of Alka-Seltzer as an antacid. Again, I keep bringing up my dad because he is my case here that I'll share with you. Many years ago, when I was an undergrad student, my dad again was having a lot of heartburn, and he had been taking Alka-Seltzer. And I remember him calling me one day after class, and he's like, "My nose is bleeding." And I was like, "Oh no, what's happening?" So I, in fear, drive was about a 30-minute drive. I drove home, to make sure my father was okay. And I realized that it was just a nosebleed. It had stopped by the time that I got home. It was very little. He was not on any blood thinners. He was not on any other medications that would cause it. He hadn't been doing anything strenuous, but I asked him, "Dad, what medications have you been taking?" And he's like, "Oh, I've just been drinking Alka-Seltzer," because he likes, again, caffeine, and he likes carbonated products. So he liked the fizz of Alka-Seltzer. And I was like, "Oh no, Dad, we have Tums. Don't take the Alka-Seltzer," because I realized that it was the aspirin content that was actually causing him to have that bleeding. So in place of Alka-Seltzer, I would recommend using Tums or is antacid properties as opposed to the Alka-Seltzer. So if you don't take anything away from today's presentation, keep that in mind. Tums versus Alka-Seltzer, my go-to would be Tums. We've talked about how they work in terms of neutralizing the stomach acid. And remember, I talked about the different symptom categories. We have mild, moderate, and severe. Antacids are recommended to be used for those milder symptoms. So those symptoms that come and go, or the symptoms that only occur about 1 or 2 times per week. Antacids like Tums or milk of magnesia or Maalox would be good to manage those symptoms. You would take them as needed when you start to feel the symptoms of the heartburn. They work relatively quickly. So you would take them at the onset of the symptoms. As much as they help in decreasing the symptoms of heartburn, there are some possible side effects of those, including bloating, some stomach discomfort, and even at times diarrhea, constipation, and headache. So I wanted you all to be aware of those as well. And that's it for antacids. We're going to be moving on to our second bucket here, which is our Histamine 2 blockers. The two types of Histamine 2 blockers that are available over the counter on the market right now are Pepcid or famotidine, and Tagamet, which is also known as cimetidine. I've included the pictures of those here for your reference. And we'll be talking about each of those here in the next slide. Talked about those two examples. So very similar to antacids, they also work to neutralize the acidic content, but the difference is they also decrease the amount of acids that's produced by the stomach. So not only are they neutralizing the acid that's already there, they're also decreasing how much acid is produced by the stomach. So therefore, they are recommended again for those mild symptoms, but mild intermittent symptoms, which are about 2 times or less per week. In terms of its duration of use, it's recommended to use them for about 2 weeks and seeing if that helps with symptoms. It can be used for longer than 2 weeks if it is needed, and that's something you'd have to discuss with your pharmacist or your physician to see if that's appropriate based on how much symptoms you're still having. They work also relatively quickly, not as fast as the antacids, but they work in about 1 to 3 hours. and can last for several hours after you take them. So you can take them both for relief of the symptoms of heartburn as well as for prevention of the symptoms of heartburn. So they're kind of a in-between agent between our antacids and the next one that we'll talk about here in a moment, our PPIs. As we did with the antacids, I also wanted to share some possible side effects of these agents. Again, our headaches. 1% of the patients who these drugs were studied in experienced dizziness. And then the remainder had more of GI or stomach issues, being diarrhea and constipation. And now moving on to our third bucket of over-the-counter agents that are available to be used for heartburn is our proton pump inhibitors, or PPIs. We have Prilosec OTC, or omeprazole, Nexium, or esomeprazole. We have Prevacid, which is lansoprazole. And then lastly, we have Zegerid, which is a combination of sodium bicarb and omeprazole. You might have seen these. I think the most commonly seen one is either Prilosec or Nexium, or even sometimes Prevacid, but I would say Prilosec and Nexium are the ones that I've seen more commonly. So a little bit more about PPIs. How do they work? They also work very similarly to how our H2 blockers work, in the sense that they decrease the amount of acids that's produced by the stomach. So think of it this way: the H2 blockers kind of work to block histamine from binding to its receptor. What does that mean? It means that our body has a process where something kind of goes to unlock a lock and causes the release of the acid. So what the H2 blockers is they prevent that unlocking from happening. Whereas our proton pump inhibitors kind of block the pump that secretes the acid. So they work in similar ways, just maybe one's at the top, one's at the bottom. Because PPIs work directly on the pump, they are considered to be a little bit more potent than the H2 blockers. And because they're considered more potent, they were recommended to be used for more frequent symptoms of heartburn. So the heartburn that is either around all the time, or it comes and goes, but it happens more than 2 times per 2 days in a week. So for our more severe symptoms, you might see proton pump inhibitors, or PPIs, used. One thing that I wanted to highlight about the PPIs, and I've highlighted and bolded and underlined because it's very important to know, is that PPIs are recommended to be used again for a 14-day course of treatment. And they can be used up to 3 times per year. That's how the manufacturer studied it. That's how the labeling is stated to be used. There are some patients that have been on this medication for a very, very long time based on their discussions with their physicians. But being on it for a very long time also comes along with some things to keep in mind, which we'll discuss here in a moment. So as a pharmacist, whenever I'm looking at medications for my patients, if I see a PPI that is being used for a very long time, I always ask questions about it to make sure it's appropriate for patients to be using it for those prolonged periods of time. Because it is reserved for frequent symptoms, it's actually not meant to be used for immediate relief. It can take up to 4 days for you to start getting relief of symptoms from the use of these agents. So it's not like our antacids that start working almost immediately, and it's also not like our H2 blockers that can work within 1 to 3 hours. These ones can take days, up to 4 days, before you start having relief of those symptoms. Some possible side effects, again, we have our general headache, dizziness, diarrhea, and constipation. However, these ones also come with an increased risk of C. diff, which is an infection that happens in our abdominal area and can lead to diarrhea. It can also increase the likelihood of having bone loss and fractures, as well as a loss of magnesium. So all of these things considered is why we don't recommend long-term use of these medications, because they come with a number of risks to be aware of. All right, so now we've spent a lot of time talking about heartburn. We've discussed what heartburn looks like. We've discussed some of the things that worsen heartburn, some of the things that we can do in terms of our lifestyle to improve heartburn, and then some medication options that are available to treat heartburn. And now I want to kind of pivot a little bit with the remainder of our time and talk about heart attack. What does that look like? And what do we do if we think we're having a heart attack? So what is a heart attack? A heart attack happens as a result of a blocked coronary artery, which is a blood vessel that feeds our heart. So as you can see here, I'm not sure if you can see my mouse, but our lovely
You can see your mouse.
You can, thank you, thank you. Our lovely gentleman here, unfortunately, is having a heart attack. And as you can see, he's pumping his chest because of that pain that he's feeling. There is a blood vessel that is located within the heart. And as you can see here, there are these yellow deposits, which are fat deposits or plaque that has accumulated over time and now is blocking the flow of blood to the heart. So when the heart is not getting enough of a supply to it, it can cause something that's ischemia and leads to basically cell death and tissue death within the heart. And that blockage can is manifested, if you will, as a heart attack. So there's a blockage in the heart is not getting enough blood, patients get a heart attack as a result. The symptoms and the signs of a heart attack is quote unquote similar to a heartburn because it happens in the chest area. However, there are major differences between a heartburn symptom and a heart attack symptom. Remember that we talked about the heartburn being more of that burning sensation that's located within the mid-chest, sometimes behind the rib cage. The symptoms of a heart attack is chest pain and discomfort that can travel either into the jaw, the neck, and sometimes the arms and the back. So it doesn't just stay within the middle of the chest area, although it can. Most of the time, you'll see that traveling pain within the arm, the neck, and the jaw area as well. Some patients, when they're having these symptoms of a heart attack, may also overall feel very weak, sometimes feel lightheaded, and feel faint. So remember I talked about that arm pain? Most of the time is in one arm, but very often it can also happen in both arms. And lastly, when patients are experiencing that chest pain and discomfort, they may also feel short of breath because of everything that's happening within their heart. So a key takeaway from the symptoms of a heart attack versus a heartburn is, as its name suggests, the pain of a heartburn is more so burning and it's located in the middle of the heart. Whereas a heart attack is chest tightness and pain that can stay in the middle of the heart, but can, in the middle of the chest rather, but can also travel into the jaw, the neck, the back of the arm, or both arms. There are some unusual signs of a heart attack, being that tiredness and even sometimes nausea and vomiting. And the studies and the research that we have show that these unusual signs and symptoms of a heart attack are most commonly observed in women as compared to men. Not saying that it's impossible for men to have nausea and vomiting when they're experiencing heart attack, but more commonly you'll see those in women. I'm not going to go into the medications that we use to manage a heart attack. We'll reserve that for another day. But what I do want to share at this point is, what do we do if we think we're having a heart attack? Our lovely lady here in the red, she is on it. She's got her phone in her hand and she's doing exactly what she knows she's meant to do. She observes symptoms, is to call 911 immediately. Or if you're able to go to, or have someone take you to the nearest hospital as soon as you start to observe some of these symptoms of a heart attack. And we get there in time, and they'll take you through the processes that are done to treat and manage and hopefully prevent further heart attacks from happening. So at this point, I know I have thrown a lot of information at you. I've shared a lot of stories about my father with you all, and I'll be happy to answer any questions that you have, or even hear some thoughts as to what your experiences have been in the past, or what your thoughts about this presentation was. So I'll open the floor for any questions or any thoughts at this moment.
Thank you very much.
My pleasure.
I'm sure we'll have some questions or comments, so we'll just give that a moment. But thank you for this very
Yeah.
informative presentation.
My